Introduction. Understanding sleep disturbances during perimenopause. One winter, I gained 20 pounds seemingly overnight, and my energy levels plummeted. I struggled to sleep through the night, constantly waking up drenched in sweat or feeling anxious. Like many women, I thought these issues were just a normal part of aging. However, sleep disturbances during perimenopause are more than just an inconvenience. This article aims to debunk common misconceptions about sleep and perimenopause, providing evidence-based information to help women understand and manage their symptoms. Perimenopause is a transition marked by fluctuating hormones, particularly estrogen and progesterone, which can lead to symptoms like hot flashes, mood swings, and yes, sleep problems. Sleep plays a vital role in maintaining physical and mental health. Without adequate rest, our bodies struggle to regulate hormones, manage stress, and support overall well-being. Addressing sleep disturbances during perimenopause isn't just about feeling more rested. It's about improving long-term health outcomes. This guide will walk you through the common myths and the real science behind perimenopausal sleep issues, empowering you to take control of your health. Misconception 1. Sleep disturbances are just a normal part of aging. Many people think that poor sleep is something you just have to accept as you get older, but that's not always true. During perimenopause, hormone levels, especially estrogen and progesterone, start to fluctuate, which can lead to issues like night sweats, hot flashes, and insomnia. These hormone changes are a major reason why so many women struggle with sleep during this phase. In fact, research shows that up to 60% of women deal with sleep problems during perimenopause. Misconception 2. Sleep problems will get better on their own. Hoping your sleep issues will go away by themselves can actually put your health at risk. Ongoing sleep disturbances can increase your chances of developing chronic illnesses like heart disease, diabetes, and anxiety. If you're consistently struggling to get good sleep, it's important to talk to a healthcare provider before the problem worsens. Misconception 3. There's nothing you can do to improve sleep during perimenopause. There are plenty of ways to improve sleep. Simple lifestyle changes, like exercising regularly, eating well, and sticking to a sleep routine, can make a big difference. Relaxation techniques, such as deep breathing or meditation, can also help. And if those aren't enough, speaking with a doctor about medical options like hormone therapy or sleep aids can provide additional support. The science behind sleep disturbances during perimenopause. Sleep disturbances during perimenopause are often caused by hormonal changes, particularly fluctuations in estrogen and progesterone. These hormones play a key role in regulating sleep. When their levels drop, women may experience hot flashes, night sweats, and increased anxiety, all of which can disrupt normal sleep patterns. The brain also plays a crucial role in regulating sleep, and perimenopause can affect brain function. The hypothalamus, responsible for controlling body temperature, is influenced by changing hormone levels. This can lead to hot flashes and night sweats, which wake women up in the middle of the night. Additionally, perimenopause can impact the brain's ability to maintain a stable sleep-wake cycle, making it harder to fall and stay asleep. Neurotransmitters like serotonin and melatonin are vital for sleep regulation. Serotonin helps stabilize mood and sleep, while melatonin signals the brain when it's time to sleep. During perimenopause, fluctuations in hormone levels can affect the production and release of these neurotransmitters, making it more difficult to get restorative sleep. As a result, women may experience difficulty falling asleep, staying asleep, or waking up feeling refreshed during this transition. The impact of sleep disturbances on health and well-being. Sleep disturbances can have serious consequences for physical health. Chronic lack of sleep is linked to weight gain, which I experienced firsthand. Over time, I gained 30 pounds, 20 of those in just one winter, and went up 4 clothing sizes. Without adequate sleep, the body struggles to regulate hunger hormones, making it easier to overeat and harder to lose weight. Sleep deprivation also increases the risk of heart disease, diabetes, and other chronic conditions, which can further impact physical health. Mentally, ongoing sleep problems can take a toll as well. Lack of sleep is associated with anxiety, depression, and even cognitive decline. It's hard to feel focused or motivated when your brain is constantly tired. This cycle only worsens over time, making it difficult to break free from the effects of sleep deprivation. The overall quality of life also takes a hit. When you're not sleeping well, everyday tasks become exhausting. I personally noticed a drop in energy, and the simple act of getting through the day felt overwhelming. The combination of physical and mental fatigue makes it hard to enjoy life, creating a sense of frustration that compounds over time. Effective strategies for improving sleep. Improving sleep became a priority for me when I realized how much my mental and physical health were suffering. I was dealing with high anxiety and depression, but resisted getting help for a long time. Eventually, I spoke up to my OBGYN, and with support from my new primary doctor, I started on a low-dose generic antidepressant. I didn't want to be over-medicated or labeled, but the red flags were too obvious to ignore. I was hypersensitive to things that wouldn't normally bother me, experiencing mood swings, breakdowns, and even breakouts on my skin. Lifestyle changes played a huge role in improving my sleep. Creating a relaxing sleep environment and sticking to a regular bedtime routine helped me get back on track. I also made sure to avoid caffeine and other stimulants in the evening, which had a noticeable impact on my ability to wind down. Managing stress was another key factor. Meditation, deep breathing, and yoga became essential parts of my routine to reduce stress levels and calm my mind before bed. Finally, medical interventions like hormone therapy or sleep medications might be necessary for some people, but it's important to work with a healthcare provider to find the best approach for your needs. Seeking professional help. If sleep disturbances are affecting your daily life, it might be time to see a doctor. I went through at least 4 therapists and counselors before anyone recognized the extent of my anxiety. Signs like ongoing fatigue, mood swings, and difficulty focusing can indicate that your sleep problems need professional attention. Healthcare providers such as sleep specialists, endocrinologists, and primary care doctors can help identify the root cause of sleep issues. Treatment options might include medication, therapy, or lifestyle changes. Don't hesitate to seek support. Finding the right help can make all the difference. We've explored the science behind sleep disturbances during perimenopause, common misconceptions, and effective strategies for improving sleep. Addressing sleep problems during this phase is crucial, not only for better rest but also for overall health and well-being. Ignoring sleep issues can lead to long-term health risks, but by making lifestyle changes and seeking professional help when necessary, you can take control of your sleep and quality of life. If sleep issues are impacting you, now is the time to act. Comment below with your experiences, like this video, and don't forget to watch more for helpful tips.